Sound check, 1, 2, 3, okay. Magandang araw po sa ating lahat. Kumusta po kayo? Sana po ay nasa mabuti kayong kalagayan at ngayon nagbabalik tayo sa ating rationalization on common questions in med-surg, specifically on the care of clients with peripheral vascular disorder. Okay, so wag na tayo magpatumpik-tumpik pa, simulan na natin agad. Okay, number 1. One goal in caring for a client with arterial occlusive disease is to promote vasodilation in the affected extremity. To achieve this goal, the nurse encourages the client to A. Avoid eating low-fat foods. B. Elevate the legs above the heart. Letter C. Stop smoking. And letter D. Begin a jogging program. Ang sagot po natin dito is letter C. Stop smoking. Smoking should be stopped kasi it causes vasoconstriction. Again, ang sagot natin dito is letter C. Stop smoking. Smoking should be stopped kasi it causes vasoconstriction. Okay, huwag mo natin kalilimutan. Number 2. The client with Buerger's disease experiences which of the following signs and symptoms? Buerger's disease po ang tinatanong. A. Thickening of intima and media of the artery. B. Inflammation and fibrosis of arteries, veins, and nerves. Letter C. Vasospasm lasting several minutes. And letter D. Pain, pallor, and pulselessness. Our answer here is letter B. Buerger's disease is inflammation of arteries, veins, and nerves. The primary factor associated with Buerger's disease is cigarette smoking. This is very common question and very common concept. Huwag po nating kalilimutan. Next question, number 3. Stress can produce vasospasm in clients with Raynaud's disease. The client states she is worried about making the necessary behavioral changes to control the vasospastic episodes. Which of the following diagnosis is appropriate? A. Activity intolerance related to Raynaud's disease. B. Anxiety related to change in health status. Letter C. Disturbed body image related to illness treatment. And letter D. Impaired social interaction related to self-concept disturbance. Sabi ng patient, she is worried about making the necessary behavioral changes to control the vasospastic episodes. Therefore, our answer here is letter B. Anxiety related to change in health status. Changes in a client's lifestyle and health can cause anxiety. Next question, number 4. Which of the following increases the risk of having a large abdominal aortic aneurysm rupture? Again, which of the following increases the risk of having a large abdominal aortic aneurysm rupture? A. Anemia. B. Dehydration. C. High blood pressure. And letter D. Hyperglycemia. Ang sagot po natin dito is letter C. Hypertension is the primary factor associated with aneurysm. It causes weakening of arterial walls that results to irreversible dilation. Sagot po, high blood pressure. Number 5. A client diagnosed with thrombophlebitis suddenly complains of chest pain and shortness of breath and is restless. The nurse should assess the client for A. Myocardial infarction, B. Pneumonia, C. Pulmonary embolism, and letter D. Pulmonary edema. Ang sagot po natin dito is pulmonary embolism. It is the most life-threatening complication of DVT and thrombophlebitis. Chest pain is the most common initial manifestation. Again, chest pain is the most common initial manifestation. Other signs and symptoms are dyspnea, cough, diaphoresis, and apprehension. Again, our answer here is pulmonary embolism. Number 6. A 34-year-old male is diagnosed to have Buerger's disease. The nurse notes intermittent claudication in the arc of the foot and thrombophlebitis of the lower leg. Which of the following factors is associated with Buerger's disease? A. Familial pattern toward peripheral vascular disease. B. Smoking history. C. History of recent insect bites. And letter D. Recent exposure to allergens. Our answer here is letter B. Smoking history. Nasabi na natin to kanina. The primary factor associated with Buerger's disease is cigarette smoking. It also has an autoimmune component. Huwag nating kalilimutan, ang sagot natin dito is letter B. Okay, number 7. Which of the following manifestations would least likely be experienced by the client with abdominal aortic aneurysm? Again, which of the following manifestations would least likely be experienced by the client with abdominal aortic aneurysm? A. Pulsatile abdominal mass. Letter B. Bruit on auscultation of the mass. Letter C. Hyperactive bowel sounds. Letter D. Sensation of heart beating in the abdomen. The correct answer here is letter C. Hyperactive bowel sounds. Hyperactive bowel movements sounds are not related to abdominal aortic aneurysm. The other choices A, B, and D are manifestations of abdominal aortic aneurysm. Pulsatile abdominal mass, brewy on auscultation of the mass, and sensation of heart beating in the abdomen. Yan po ay mga manifestation of abdominal aortic aneurysm. Except yung sagot natin na hyperactive bowel sounds. So, sagot natin is letter C. Number 8. Lasix or furosemide is contraindicated if the client has hypersensitivity to A. Sulfonamides, B. Penicillin, C. Aminoglycosides, and letter D. Quinolones. Our answer here is letter A. Sulfonamides. Furosemide is contraindicated if the client has hypersensitivity to sulfonamides because of its chemical similarity. Furosemide's chemical structure is similar to sulfonamides and this will increase the risk of severe allergic reactions. Inuulit ko po, furosemide's chemical structure is similar to sulfonamides. Kaya contraindicated po ang furosemide if the patient has hypersensitivity to sulfonamides. Okay, number 9. A client with hypertension is on ACE inhibitor, monopril. Which of the following diuretics is contraindicated? A. Lasix, B. Bumex, C. Aldactone, and letter D. Hydrodiurel. Ang sagot po natin dito is letter C. ACE inhibitors should generally not be taken with potassium-sparing diuretic or salt substitutes that contain potassium because of the risk of hyperkalemia. Again, ACE inhibitors should generally not be taken with potassium-sparing diuretics like yung aldactone na sagot natin or salt substitute that contain potassium because of the risk of hyperkalemia. Our answer here is letter C, aldactone, a potassium-sparing diuretics. Number 10. The following are clinical manifestations of arterial insufficiency. Select all that apply. A. Leg pain relieved by rest. B. Cold skin in the lower extremities. C. Reddish skin in the leg. And letter D. Diminished pulse in the leg. Letter E. Edema improve with elevation. And letter F. Loss of hair in the legs. Letter G. Presence of gangrene. Sa letter A, isa-isahin natin. Sa letter A, leg pain relieved by rest. Arterial insufficiency ba yan? Yes or no? Yes, because reduced blood flow causes muscle pain relieved by resting. Kaya check yung letter A. Sa letter B naman, cold skin in the lower extremities, arterial insufficiency ba yan? Yes or no? Yes, kasi decreased blood flow also reduces warmth. Yung letter C, reddish skin in the leg, arterial insufficiency ba yan? Yes or no? Hindi po siya arterial insufficiency. Reddish skin in the legs typically indicates venous insufficiency, hindi po arterial, kaya mali po. Sa letter D, diminished pulse in the leg. Arterial insufficiency ba yan? Yes or no? Yes. Kasi reduced blood flow weakens pulse. Check po ang letter D. Yung letter E naman, edema improve with elevation. Hindi siya arterial insufficiency, kundi venous insufficiency, kaya mali din po. Okay? Next, loss of hair in the legs. Yes, arterial insufficiency po. Kasi decreased blood flow impairs hair growth. Yung letter G, presence of gangrene. Arterial insufficiency ba yan? Yes or no? Yes, kasi severe prolonged ischemia leads to tissue death. Okay, so again, our correct answers here are letter A, B, D, F, and letter G. Arterial insufficiency causes decreased supply of oxygenated blood, specifically in the lower extremities. It is characterized by intermittent claudication, skin is cool to touch, thin, shiny skin in the legs, loss of hair in the legs, pale skin on elevation of legs, diminished or absent pulse, ulcers in the toes, gangrene develops, decreased sensation, numbness, paresthesia, and itching in the legs. Okay, so hanggang dito muna tayo guys. Until next time, mahal na mahal ko po kayo. God bless us all.